Alright, what's up YouTube? It's Matt here. Just want to talk to you guys about my testosterone replacement therapy and what I went through to get here. Um, Maybe it'll benefit, some of you guys to hear these things. If you are just happen to be going through some of the same things that I dealt with. So, about a little over 2 years ago, I was living in New Orleans, Louisiana, having the greatest time, partying probably too much. Um, but living the life, and everything felt great. I felt amazing, and all of a sudden one day when I was at work, I started getting this like nodding, like dizzy spell. I'd just be working, and all of a sudden I would just like feel like I'm gonna pass out. And then they slowly like, and I like, well, at the time I didn't know what was going on. I had to sit down and thought maybe it was my blood sugar or something. And I didn't know what was going on. Um, so I went back to work. It just kept happening the rest of the day, and then it's just like it wouldn't happen, but like probably once a week. And then it started getting to where it was like every other day. And then it became an everyday thing. Um, I didn't know what was going on, so I went to the doctor. I actually saw a couple different people. They sent me someone who specializes in vertigo. They thought maybe I had vertigo. Because it seemed like I was just spinning and stuff like that. If you don't know what vertigo is, it's an inner ear infection, and it causes your equilibrium to be off, and it'll make things like spin, and there's all kinds of different types of vertigo. But anyway, so I went to the doctor, got his test done, did an MRI, came back, I didn't have vertigo, which was great. They thought maybe I just had anxiety. I was like, I don't know, because I never had problems before all this happened. Like, it's gotta be something else. But anyway, so I was like, listen to the doctors. They put me on Buspar. I personally hate SSRIs. I'm sure there's a lot of other people out there that hate them. I personally hate taking medication. I don't really like to do it. I like to be all natural. Testosterone, I'm not sure if that's really considered all natural, but uh, yeah, I'll get into that. So let's see, let's go back. Um, so anyway, say I took I took Buspar, and I took it for about a month or two. Um, and everything was great. I was feeling good. I still had maybe some problems every once in a while, but it was starting to get better. But then I started like hallucinating and getting all these like more dizzy spells and it's just weird thoughts and stuff. And I had to quit taking the medication. I was like due to refill another bottle, and I was just like, I'm done. I'm not doing this anymore. So I stopped taking it, and I was okay for about a month or so, and then I started getting the dizzy spells again. And I did that for probably about 17 months. I thought that I was maybe gluten tolerant because I've heard of people having gluten related to like dizzy spells and things like that. And I actually quit eating gluten for 17 months. I didn't eat gluten at all. Completely cut it out. Um, and it did seem to help, but I was still like having problems. But in my eyes, it was like if I ate it, it got worse. But really, I think it was just anxiety. That was just getting in my head. But so, anyways, about about 3 weeks ago, I had to take medical leave from work. Um, that's the second time this happened to me, and I went to the doctor, and they were like, "Oh, I think you have general anxiety disorder, and maybe possibly OCD." I was like, OCD? Like, I don't think I'm OCD, I don't, because I've seen people with OCD, what they go through, and I don't think that I have that problem, or do those things. And he's like, well, what you're doing is, because like every day at work, around a certain time, I would started to feel dizzy and I have to go sit down. He's like, I think you're just dealing with anxiety and having to go sit down, and you're doing these things on routine like every day, or which probably is anxiety. I was going to places where I've had panic attacks before, and I would work myself up to it before I went back to that place again, and what would happen? I would get another panic attack. So he was just saying I was kind of like doing things in routine like that, maybe. But I was telling him, like before all this happened, I didn't have any problems. I didn't have any anxiety. I didn't deal with any of this stuff. Um, so, I started becoming depressed, mainly because I had just been dealing with this for 2 years. It was really hindering me on life. It really was. And about right when I just took this medical leave from work, I started feeling like I was becoming agoraphobic, where you're like afraid to get out and go do things because everywhere I went, it seemed like I had problems. Um, but like I said, before all this happened, I didn't have any problems at all. So as a doctor, I'm talking to him, and he's like, I think you need to work out like 4 or 5 times a week just to like build your confidence up, and um, it'll probably help you feel a lot better, because I'm already like a real skinny guy. I should have done this video 3 weeks ago because I put on a little weight and I was really pale before and just didn't look healthy at all. But so he was talking about that, and I was like, I've been reading so much about anything that could cause dizzy spells, and I was like, you know what? Speaking of working out, what about my testosterone? Did they, if they checked that, my blood work? And he was like, you know what? That's a good idea. Like, you're the doctor. But anyways, so he, well, no, he's a good doctor. But anyways, they checked my testosterone levels. The next day, I get a call, and they're like, "Yeah, your testosterone is super low. You're at a 94." And I think for my age, I'm supposed to be between like 500 and 750 for my testosterone levels. It was like a third of what an 80-year-old man is. I think 80-year-old men are like 300, 370 something is their testosterone. I was less than that. It's crazy. So they put me on testosterone replacement therapy, and I'm so glad I did it. I've been feeling so good for the last 3 weeks. I feel great. I've been putting on muscle. My mood has been getting better. I've been getting out of the house more and doing things. Um, I've worked out before and I never could put on size. Last, I think it's been like 23 days now since my first shot. Getting, I'm like a few days in after my third shot now. Um, I put on 15 pounds, 23 days, 15 pounds. I was at the same weight for probably 7 years. I can never put on weight. I put on 15 pounds. Crazy. Um, I noticed a few little things like my facial hair just seems like it's wanting to kind of grow a little thicker. I know you can't really see any on here, but I did just shave yesterday. But it does seem like it's wanting to come in a little thicker, which is good. Like I was saying, like my muscles, whenever I work out, they are starting to look like they're wanting to show through a little more. I also notice that whenever I do work out, usually I'm at the same weights for a while. It takes me a while to move up in weights, but I noticed that I've been like exploding through weights. I've been going up like 20 pounds at a time instead of like 10 pounds at a time. And being at that for a while, I've been going up like 20 pounds. Like just exploding. I can't wait because I'm gonna be like a beast here before long. But let's see. I think I touched everything pretty much. I just wanted to do this video because I know there's a lot of people out there probably struggling, don't know what's going on, you know, uh, and might be going through the same thing that I went through. So if any of you guys like having these problems, fatigued, dizzy spells, anxiety, depression, like before you get on like SSRIs or benzos or stuff like that, like do yourself a favor and just get your blood checked. Check your levels. It could be something else besides testosterone, but check your levels. Because I tried everything, man. Like I tried the vegan diet. I tried going gluten free. I cut out dairy for a while. I tried paleo. I tried different kind of herbs. I do want to say that if you do just have anxiety, definitely check out St. John's wort. It's a herbal, it's a herb, very great herb, medicinal herb for anxiety, depression. Kind of, they call it the nature's Prozac, but it works really well. Um, I don't currently take it now, but I have in the past, and it did work well for me. Put me in a good mood most days. Um, and I used to get like angry a lot and stuff sometimes at work, and it definitely like cut that out too. It really helped a lot. Kind of helps train you, I guess, a little bit. But yeah, so I'm gonna be here. If you guys have any questions, let me know. I'd like to hear from you guys what your thoughts on testosterone replacement therapy is. I'm currently at 3 weeks in, and I'll probably do another video when I'm at 5 weeks, and couple of months, maybe do some before and after photos of my progress. But yeah, so I'm going to keep you guys updated. All right, later, YouTube.